Okay, so for our first case study around the continent and around nuclear medicine on the continent, we're going to go to Zimbabwe. And I'd like to welcome Mrs. Eucaria Mushosho, who is acting dean of the School of Allied Health Sciences at Harare Institute of Technology. Mrs. Mushosho, thank you very much for your time. So you can go ahead with your presentation.
Okay, thank you, Prof. Katerere. I'm going to present on nuclear medicine in Zimbabwe. So my introduction is why present on nuclear medicine on a radio-pharmaceutical symposium. Really, when we talk of nuclear medicine, it's all about the use of radio-pharmaceuticals, either for treatment or for diagnostic purposes. So if we are going to talk of radio-pharmaceuticals, we have to talk about nuclear medicine. And it's actually key, given the rise in cancer cases, especially in Zimbabwe, right? I'm going to give you a background. So approximate population was slightly over 14 million, and the cancer 83 new cases were reported in 2020, and we had about 10,676 deaths. And the most occurring cancers were cancer of the cervix with 18.9% of all cancers in Zimbabwe, then breast cancer with 11.5%, and prostate cancer 9.7%. This information, I got it from Global Cancer Observatory, which was published in 2020. In Zimbabwe, or even in the sub-Saharan Africa, there is late presentation with advanced disease, and at times at younger ages when we compare with Western countries, right? And when we have advanced disease, what it means is there is metastatic spread, which needs systemic treatment using radiopharmaceuticals and other treatment modalities, right? From the statistics I've given you, breast cancer is one of the most prevalent cancers, and this metastasizes to bones, and radiopharmaceuticals now play a key role in managing such metastatic disease. We can also talk of prostate cancer. You also need the use of radiopharmaceuticals to manage advanced cases. Radiopharmaceuticals are not just used in the treatment of malignancy, but we also have got benign cases which are managed by radiopharmaceuticals. A few examples: thyroid pathologies like thyrotoxicosis, urinary tract pathologies, and joint diseases. They are actually managed by radiopharmaceuticals. In nuclear medicine, diagnosis and treatment of most advanced cancers and benign conditions are done, like I've said before, using radiopharmaceuticals. And currently, we are using hybrid imaging, which is PET-CT, which requires the use of radiopharmaceuticals as well. But apparently, in Zimbabwe, it's currently just a dream. We don't have a PET-CT scan, right? But this allows one to investigate the anatomical as well as the physiological changes caused by cancer or other benign pathologies like thyrotoxicosis. And nuclear medicine for educational purposes. For continuity, there's need to train nuclear medicine specialists. And this requires functional departments and availability of radiopharmaceuticals. Theoretical education without clinical exposure will create a competence gap. Right, now, history of nuclear medicine in Zimbabwe. I've given you a background, but now in Zimbabwe, in the early 90s, there was one nuclear medicine department which was functional, and this was headed by a nuclear medicine practitioner or a nuclear medicine radiographer who was trained in UK. And He had a master's in nuclear medicine, and this radiographer would work with other on-the-job trained radiographers who were trained under the International Atomic Energy Agency fellowships. So with these fellowships, what would happen is that an interested radiographer will be identified and they could be sent to any nuclear medicine center where they will receive on-the-job training, and they would come and work under a qualified person, right? And during that time, there was no qualified resident nuclear medicine physician, and there was no qualified medical physicist. We depended on visiting medical physicists who were seconded by IAEA to Zimbabwe. Right now, late 90s, there was a second nuclear medicine department which was opened in Harare, and this was private owned. The private and the government centers worked well in collaboration, and at some point, even the physician from the private center would come and assist with consultations and reporting at the government institution. But apparently what then happened, because normally in Zimbabwe, private pays better than the government, we ended up having some experienced radiographers which were trained by international atomic energy agencies moving to private for better earnings. Almost at the same time, a third nuclear medicine department was opened in Bulawayo. This one was a government institution, still a challenge, but departments continued to function. Infrastructure development of the government centers was done with the assistance from IAEA. And in those centers, we only had gamma cameras. And radio-pharmaceuticals for all centers were imported. So what happens was that requests would be sent to South Africa after booking patients so that they import sufficient radioisotopes to cover the booked patients. But we had major challenges, right? One of the major challenges is there are no radio-pharmaceuticals produced in Zimbabwe. And what this means is Zimbabwe depended on imported radio-pharmaceuticals from South Africa, and given limited lifetime or the lifespan of some radio-pharmaceuticals, at times after acquisition, machines could break down, and because of the delay in repairs, the radio-pharmaceuticals could degenerate before being used, and that was money down the drain. Then late 2000, the private center closed, and probably it was due to viability issues, given the above challenges that I've mentioned. Then one of the public centers was also closed due to failure to meet the regulatory authority standards in terms of staffing requirements, right? The staffing requirements in Zimbabwe is such that every nuclear medicine center, for it to function, there is a requirement that we should have a nuclear medicine physician, nuclear medicine physicist, and nuclear medicine radiographers. But apparently in Zimbabwe at that time, we didn't have any nuclear medicine qualified physician, and the most qualified person who was working in the nuclear medicine was the radiographer who had a master's in nuclear medicine. And also during that time, we really had very few nuclear medicine trained medical physicists. So the department was actually, you discover from that time, because we didn't have qualified people, the nuclear medicine department in Harare was closed, but the one in Bulawayo, a qualified doctor was sent to South Africa for training. And during the time he was on training, Zimbabwe existed with no functional nuclear medicine department. So those that needed the services would come to South Africa. And now, interesting enough, South Africa is now charging double hospital fees for foreigners. So given the current scenario, where do we go from here? My recommendations or my dream is that Zimbabwe should start thinking of producing radio-pharmaceuticals. Don't ask me how and when, but we are hoping as we continue to have these collaborations and these meetings, we should be able to share ideas and come up with ways to alleviate such challenges. Also, I recommend a training of trainers which should be done in radiopharmacy and nuclear medicine. Introduction of the radiopharmaceutical module to departments of pharmacy, where pharmacy is offered in Zimbabwean universities, because currently our pharmacy students, even at Harare Institute of Technology, they don't have a module in radiopharmaceuticals. And it's high time we start by collaborating with other regional universities in training of nuclear medicine radiographers. In training is key during such challenging times. My motivation, let's fight on and not surrender. Definitely there's a way forward. It's too early to surrender. Let's share the ideas. Let's collaborate and lift each other up as we fight the challenge together. Thank you.